Have you been doing kegels for years upon years and are just getting so frustrated that you can't get anywhere with it? Well, I want to take some of the pressure off of you today. In this episode today of Longevity, where we intersect health and science and longevity and wellness and everything in between, we're going to look at the dose related phenomena of Kegel exercises and other techniques to try to strengthen the pelvic floor. So I'm glad you're here and I hope you really enjoy today's episode. But before we begin, we try that again. But before we begin, and a couple of important notes to take in mind. First of all, the content that's here on our podcast is educational. It is not designed to diagnose, treat, prevent, or cure any disease. It's really important that you have these conversations alongside your primary care provider. And the educational content that's here is to help you stimulate really important questions along the way. So I'll encourage you to go and talk about these. Sorry, I'll do that again. So I encourage you to go and talk about these important topics with your trusted care provider. And in the meantime, let's begin. So I always like to start and use analogies when I'm speaking to people about different issues in my office. And this is every bit aligned with that. So there are folks out there who, again, for a number of different reasons, are experiencing difficulties with pelvic floor strength. And this can be experienced as a host of different symptoms. One of the most common ones is the little oopsie moments, where you don't want to do jumping jacks or sneeze because you have a little bit of leakage. So this can be a big concern for a lot of people, and it happens commonly at various stages in life. Just some basic statistics here so that you feel you're not alone. About 30% of 30-year-olds have trouble already with stress urinary incontinence. And this happens at a very young age and stage in life, often just related to being pregnant and childbirth. You don't have to have a natural delivery in order to have difficulty here. Just carrying a little human being inside you for months upon end with that weight bearing down on your pelvic organs can give you some difficulty. If you layer upon that a natural birth, again, it's a multiplier. So we see more of it in those situations, again, because really, if you imagine you've just passed a football through a garden hose. So there are some things that change after that. And unfortunately, urinary control is one of them. Then fast forward through life into perimenopause and menopause when estrogen is falling and hormones are haywire, and you see an additional number of women affected. So by the mid 50s, about 50%-ish of women have now stress urinary incontinence. And then keep moving forward in life into the 70s and 80s, about 70% or more than 2/3 once you get into later years start to have trouble. So this isn't a little bit of an issue, it's a huge issue. It affects most of the women around you at some point in their life, or maybe it's affecting you. So again, lots of people have tried lots of different things to help with this. So one of the most common things that gets mentioned out there are Kegel exercises. So for those of you who are not familiar, a Kegel exercise is just a contraction of the pelvic muscles. And what you're trying to do is work that area out to give it some strength. In principle, it sounds like a wonderful thing. And certainly it doesn't really come with any potential harms. It's very natural. It's just really muscular exercise. There are very, very few reasons why people shouldn't do it. And most people can and could and should. But I want you again to use a little analogy here. I want you to think about what I call the Tylenol logic or the acetaminophen logic. And, it's like giving a baby's dose to a great big massive football linebacker and expecting it to work. So dose matters. And the amount that you can do with doing voluntary Kegel contractions is limited as far as how much performance you can expect. A different analogy, imagine trying to strength train using half-pound or 1-pound dumbbells. Again, you go through all the motions, you do all the work, but there's just simply not enough weight or enough resistance to give you the outcome that you're looking for. So this is one of the things that we need to consider. And this is why there are so many women out there walking around with these problems. One, because they're not spoken of. Two, because there's not a lot of information out there about options. And three, the options that are commonly presented are often very much like a little itty bitty dose of medication for a baby being administered to a great big football linebacker. The dose and the application is just simply not sufficient. So today I want to talk about other things that have a better tendency to be productive. So first, I want to do a little bit of anatomy. So I'm going to try not to overwhelm everybody here. This is my little friend, the pelvis. And again, just to orientate you a little bit, the pelvis for men and women is a bony ring. The spine comes down and forms the back section of the pelvis. The wings or the side rims are actually where the hip would join in here in this little, if you imagine like a ball in this socket, that's where the hip would go. And then coming around to the front, the front of the bony ring, this is the pubic bone, which is actually the amalgamation of these little bones all over here. So it comes together and it makes a rim just like this. But ignore the red here for a minute. Just look at this white here, which actually represents the bony structure. The only thing that is keeping your insides in you are not the bones for support. So if we didn't have this red down here, which actually represents the pelvic floor muscles, there'd be nothing holding your insides in at all. So there is this muscular hammock made up of all kinds of different muscles, which again unify the floor of the pelvis. And this is what keeps the inside of you on the inside. So again, thinking back to this whole 30% of 30-year-olds, well, why does that happen? Even if you delivered your baby by C-section, you have had a great big weight of little human sitting here, putting pressure and bearing down on all these muscles. And again, even in late stages of pregnancy, in order to allow that little skull to come through, there are hormones that soften up the ligaments at these little joining points. I don't know if if you've been a woman who has had a pregnancy, if you started to feel a little wobbly or a little lax through your pelvis, that was your own biology releasing these hormones to try again to soften these up so there was a little more give in this bony ring in case you had a baby with a great big noggin that had to get through there. So these sorts of things contribute. Then if you had a vaginal delivery, no matter even if you have quote unquote a little baby, 5, 6 pounds, or a great big massive little sumo wrestler baby, that little baby had to come through this bony opening first with their skull, and then ultimately through the vaginal opening, which when you're not delivering, again, is like smaller than a garden hose. And it's quite amazing what anatomy allows us to do and the way we've developed as humans to actually have that tissue be so pliable at that time that it can stretch and accommodate. But having said that, most women do have some degree of muscular tearing during the delivery process. So again, this is one of the reasons why we have these problems. So the actual bearing of children can cause quite a bit of stress through the pelvis. And then again, of course, it gets weaker with the hormonal changes. But these are some of the precipitating factors, particularly why we start to see it in younger women, and particularly after pregnancy with or without a vaginal delivery, but often more severe or worse with vaginal deliveries. So this is part of the issue. So where kegels kick in is that kegels have absolutely nothing to do with the bony rim. The bones are what the bones are. But the kegels are designed to try to strengthen, if I show you from the bottom end here, strengthen the bottom musculature so that, again, you can contract and you can hold things tight with the little sphincter muscles when you cough or sneeze so that you don't leak. But these things are affected. So Kegel exercises is where you're voluntarily trying to contract these pelvic floor muscles. So you squeeze and you relax and you squeeze and you relax. So again, it is exercise, but sometimes the pelvic floor is just simply so weak that it's not sufficient. So this is where in modern times we've come into some of the newer technology. I'm just going to put my little pelvis on the floor here. This is where we've come into some of the newer technology where we're using energy in some of the different chairs that are out there to try to help the body do far more contractions than what you voluntarily could do on your own, and to contract more intensely. So these are different chairs where you sit on them fully clothed. So it's very different than a pap test. There's nothing vulnerable. There's nothing exposing. And while you sit on the chair, the chair releases energy that actually causes the muscles to contract. So it's not an electrode. You're not getting shocked or zapped. It's nothing like that. It's actually by use of a magnetic field. So again, I'm going to try not to scare you from physics. Some of you may still be scarred from your high school physics days. But again, this isn't a magical box. There's actually a scientific reason why this works. And if you like to geek out or nerd out on this a little bit, let me just spend 30 seconds describing how and why they work. So these chairs use big magnets, very much like an MRI, and the magnets create a field. So if you were tortured with grade 11, 12, or 13 if you're my vintage, physics classes, you may vaguely way back there remember Faraday's law or the left-hand rule, where you had a field and then the electrons would flow in the direction of your thumb in the current, hence the left-hand rule. That's how it worked. So again, you can actually induce current flow by exposing conductive surfaces and substances to magnetic fields. So these chairs make a magnetic field. And the nice thing about them, similar to MRI, is that there's no radiation in them, so they're quite safe. There are a few people who shouldn't have them. We can touch on that in a moment. But the vast majority of people, they're quite safe. And in that field, you don't have copper wires, but you have nerves. And nerves actually are conductive things. So when you put the nerve into the conductive field, it actually has a charge that's delivered along it, and that causes the muscles to contract. So it's completely non-invasive. There's no current of actual electricity flowing through. You're not being shocked. It's just that as this field oscillates, it's making the electrons move. That's creating a signal in your nerve, your biologic nerve, which is making your muscle contract in response to it. So we can do it far more powerfully and far more quickly. I'll give you real number examples. Some of the older technology chairs, you would do just over 11,000 of these contractions in a 28-minute session. 11,000. Just try to think about even mentally doing that. Most people get kind of fatigued doing the natural kegels after about maybe 30, if you can get that far. The newer chairs have more power. And again, we're getting upwards of over 13,000 in about half an hour. So again, we've got some new and interesting things. And these chairs really tend to be quite helpful. We ran a study in our office, which was actually quite interesting, looking at an older version of these chairs and a newer version of these chairs, just to see again if the differences resulted in different outcomes for patients. And this was one of the most lovely studies we ever did, because if I were to sum up what the results of the study, I'd call category A happy and category B happier. Most women who participated in this study, whether they used the older tech or the newer tech, went home happy. But those who are on some of the newer models today went home happier. So hence happy and happier. So how does it work? So the chairs, they have a magnet in them, and this kind of represents the magnet. So again, the magnet in the newer chairs are sort of represented in the gold here. The magnet of the older chairs is represented in the blue. It's a little tighter, a little more focal. So if I show you again, I'm going to just grab my pelvis here. So if we take a look at the size of the pelvis, although this is a model, it's pretty close to the size of the average person's pelvis. It may be a little bit small. But again, if you look at the musculature and you look at the size of the magnet, and I kind of sit it on it, the newer ones really capture pretty much all of the pelvic floor. So we get a lot of engagement of those pelvic floor muscles. The older models were more focal, and so they tended to treat more the area in and around the vagina and the urethra, where the newer models today with a larger magnet incorporate more of the supporting muscles as well. So we get a more complete treatment extending out to the whole pelvic floor. Again, to try to demonstrate this, if I tip it this way and this way, you can kind of see the sizing of them in order to get a better sense as to why the magnet size may actually have something to do with it. So the reason why I put that out is that these newer chairs, and here I'll just come back again. The reason why I like to point that out is that these newer chairs are may be of value to people who have been on an older chair where they only had partial success. Because again, the magnets are quite different than what they were. Again, these are sort of sized in real size to represent the actual size of the focal points. So again, the older and the newer. So if you tried with some of these chairs and been unsuccessful, I would say might be worth having another conversation about it and exploring it further to see if the newer technology will work for you. And again, this kind of ties back to this whole discussion about dose. So, dose matters in many, many different situations. Dose and being specific about what we're using and why. If you kind of take all those general medical principles and you apply it in this situation, a lot of the principles translate. So, if the dose, or in cases past the focal point, was a little too small, and if the problem of the musculature was actually larger and broader, partially treating the issue may have been insufficient and may have been one of the reasons why you may have had some difficulty in the past. Whereas when we have a larger magnet and more power, which is what some of the newer chairs represent, we can sometimes get better overall improvements than prior episodes, and we can get more complete treatments, and we can have more people be successful than we ever did previously. So again, you wouldn't administer a baby's dose of medication or pain reliever to a great big football linebacker. So likewise, when we look at pelvic floor treatments and energy, we need to have it done correctly. Now, there's caveats to this. Not everybody should have high power. You have to adjust it. It's important to know your own personal health issues and be with a provider who understands the technology they're working with. And as I alluded to at the beginning, there are a few situations where we don't want to be using these chairs. So important categories, this is not an all-encompassing talk, but these are the heavy hitters where we don't use the chair. In young, otherwise healthy women, one area we have to be very careful about is old school copper IUDs. Remember, this is a big, big magnet. So we don't want a magnetic metal being inside you in the target area when you're sitting on a magnet. So copper IUDs can be a real issue. We don't treat women while they have a copper IUD. And some of the other IUDs, for example, are plastic and that have hormones in them and other things. Those IUDs, as long as they don't have magnetic metals in them, are okay. But that's something that needs to be explored just to make sure we know exactly what kind of IUD you have, and we make sure that there's nothing magnetic in it. Along those lines of magnetic things, other magnetic metals that are critically vulnerable areas, even though they're a long way away from the actual chair magnet. For example, sometimes if you've had a brain aneurysm, you might have an older style of clip in your brain, a metal clip. We don't want that to move at all. So if it is unclear what kind of clip you have, then you would not be a candidate for the chair. Some people have aneurysms clips now today, actually, and they have medical alert bracelets that actually tell them what kind of MRI they can have. So those details are very relevant, and we use those details to determine safety on the chair. But without the medical alert bracelet to be very specific for us, in our office, we would call that a hard no. We would not treat those people. It's just too risky. Likewise, if you work with metals, you're a metal grinder and you've had like a metal fragment get into your eye, we have to be very sure that there's absolutely no metal in there because, again, that is such a delicate neurologic structure. We don't want that little piece of metal moving during treatment. So, again, that's an important consideration for anybody before treatment. And likewise, electronic devices. So this is more people who have health issues that may end up with a pacemaker or another implanted electrical device, but those people also should not be. Now, there's some other common considerations as well, too. We don't have time to get into everything. That's what a personal health assessment would be involved. But that's just some broad strokes. So again, magnetic metals. Just interestingly, titanium is not magnetic. It tends to be one of the metals of choice that we use for a number of different orthopedic fixing. So that tends to be safe, but everything requires a private evaluation. So dose matters, power matters, magnet size matters, and there's a lot of things we can do beyond just considering kegels to try to help with this. Again, having stress urinary incontinence is not just an inconvenience. It can lead to a lot of moisture trapping and skin breakdown and irritation. The incontinence garments can sometimes, again, trap moisture and bacteria and be a source for infection, which we don't want to see. If you're, again, recycled, let's just say, and you're getting back out there on the dating scene, again, it's your confidence going out there, not to have to wear a bladder garment. So again, there's these sensitive issues and situations that come up around it. It's just, again, not just a simple inconvenience. So it's reasonable to ask for help with these sorts of things, and we're here to support you. So that is our general overview today of the treatment. We have our pelvic floor chair here in office, and we have some very interesting things that we're trying to do these days to help people get on that chair and get that pelvic floor toned up. So again, if you have these issues and you'd like to chat further, please feel free to message. I would be delighted to speak with you, and we can look at some of the personal things that are going on there and take a look at what we can do to try to help you. I just want to give you a little bit of ways to contact us. So I'm just going to put a QR code here on the screen. So if you are, again, interested in some of these different things, please feel welcome. You can visit our website. If you look down below right now, I've got a little QR code where you can just scan that with your smartphone camera, and that should bring you into our website. On there, you can find out more about some of our incontinence treatments and pelvic floor strengthening. Alongside that as well, too, if you're starting down the road and you're wondering about perimenopause or menopause, and again, the increase in these problems as we start to lose some of the hormones, I also have some interesting reading, or hopefully interesting reading for you. This is our a book we've recently produced and gotten out there specifically on how to advocate for yourself during times of hormonal transition. It's called Hot Flash to Hot Damn, and it's available on Amazon. It has a free companion workbook. So again, if you just want to try some of the different exercises and get a sense, you are more than welcome to take the workbook. And here, I'll give you a code actually directly for the workbook. So here's the workbook below, and you're welcome to take a look at that, and you can scan that. If you like the topics we're showing here, please do consider subscribing. We would love to have you be one of our regular watchers, as well as directing the way that we go with our content. I'm always looking for what's interesting and new to talk about. So again, if you've got some things you'd like to have covered here, please message me privately. And again, subscribe to Longevanity, where we would be happy to see you and again, follow you further. So with all of that said and done, I just want to thank all of you for your time and attention today. And again, check out more on our website, as well as follow us on our socials. And again, ask. We'd love to help you out a little bit with the issues and questions you have around urinary health and pelvic wellness. Until next time, again, remember, everything we talked about here was not intended to be medical advice, but rather educational. And I highly encourage all of you to get out there and talk to your care practitioner. In the meantime, wishing you all the best of health and wellness, and I look forward to seeing you next time on the next episode of Longevanity.